But first and foremost, I have to say welcome. We're only 2 years old and a bit, and it's so nice to see so many smiling faces. I've met quite a lot of you. I've been challenged by some, congratulated by others.
Well, the first is that we have set ourselves a series of strategic aims that we measure ourselves against and measure our delivery against. And our overall aim is that we want to improve the health and well-being of our local populations. That's our vision.
So how did we spend our money? As you can see, about 53% was on acute contracts, 13% mental health, 11% community health. We approach our plan in many ways. We talk in depth with our staff. We consult and engage at length with our GPs and our member practices. We talk to organisations such as Public Health in Leeds, you and others in the public and patients.
What I'm going to talk to you about is what the work we've done with GP practice in our area to engage them. I think GPs are incredibly useful in helping us to decide what we do in commissioning, but also to work with them to deliver better quality care, to improve the care that patients get.
So it's a nice little recipe, really quick and easy. Only a few little ingredients in there. I'm going to do a little bit of chopping and you guys are going to do a little bit of chopping as well. How do you feel about that? Yeah? Yeah? And then just grate it on there like that. But with the other hand, hold that. So while you're expertly doing that, you're doing a grand little job there. This is, like I said, this is one of the dishes that we do at Ministry of Food and Leeds. And we'll chop all the way through there. Yeah? Chopping it up nice and fine. Look at that. And that there, that technique that you're using, is called the cross chop technique, yeah? And it makes you look like a master chef, doesn't it? Yeah? Yeah?
Where have you found that?
On there.
I think that was on there. So it looks like healthy eating is the winner.
First one about privatised services. I guess as a CCG, our focus is about improving the health and well-being of our population rather than who actually provides that service would be my sort of challenge back to that. We are diversifying within the NHS and outside the NHS.
Certainly as a GP who works on a Monday and a Friday, I want to improve the access to my services for my patients. But as a CCG, we recognise the complexity of it. It's about working much more effectively jointly across general practice. We've talked about how GPs can work together more effectively.
But I want to thank these guys for sitting here patiently. I want to thank you lot for sitting patiently as well, for coming. I hope you got a flavour of how we're trying to do stuff. We're so enthusiastic, we've rammed that much into today.
Here we are at Elland Road. We've just completed our AGM meeting. It was great to have so many members of the public here, but also our providers from NHS bodies and third sector. We did a good job in terms of telling people what we were about and what our vision was for improving the health and well-being of our local populations.
I think today's gone extremely well. Our AGM is a fantastic showcase of what we've achieved in the last year. It's a fantastic showcase of where the public are willing to come and tell us about their priorities and really challenge us and the NHS and the wider public sector to give what they want as the custodians of the public money to deliver healthcare that is of high quality and what they experience and what they need. So we've had many conversations with them today. It's been great to listen to their stories. They've challenged us about access to A&E, they've challenged us about access to general practice and GPs. We've talked to them about the things we're going to do in the next year to fix that and attempt to change things, and they seem quite assured that we're on the right track. I think it's been a really good event, we've learnt a lot, it's been a good opportunity to bring people together, and hopefully next year will be even better, and in between we can continue the conversation and make things better.